So the intraoperative phase is going to occur during the actual surgery. The key activities are going to be to maintain a sterile field, monitor vital signs, and assist the surgical team with whatever that they need or whatever the patient is going to need. So the nurse is going to act as a circulator, or the other word for it is a circulating nurse or a scrub nurse, to maintain safety, prevent infection, and advocate for the patient while they're under anesthesia. And also the nurse is going to work with the anesthesia provider to monitor the patient's vital signs, and make sure that if the patient, if their vitals become, their blood pressure becomes too low, to lower the sedation. But that's really going to be up to the anesthesia provider as well, but just to make sure that the patient is safe. That then is going to lead to the post-operative phase. So the post-operative phase begins in the PACU, which is the post-anesthesia care unit, and it continues throughout recovery. So the main thing is just to make sure that the patient is arousable and that they wake up from surgery. So you want to be checking their vital signs, their oxygenation. You want to make sure that they're awake and arousable as well. So key activities are going to include the airway management, pain control, monitor the wound, or any infection, or just make sure that the wound is healing, is not wide open, and preventing any complications. The complications can occur from anesthesia or from the actual surgery site as well. So, like I said again, nurse's role is going to be to assess their vital signs, manage pain, monitor for bleeding or infection, and promote a safe recovery. As a nurse, you want to also monitor for complications like bleeding and infection, and also DVTs and PEs during the post-operative phase. So getting your patients up and in the chair, get them up and walking, give them any heparin if they need to do that as well. Really just have a close eye on their vitals as well. You also want to encourage deep breathing and coughing with the incentive spirometer to prevent any atelectasis. Monitor I's and O's, make sure that the patient is able to urinate independently after surgery, and just provide education to the patient as well as their family. They just had surgery, so you want to really just drill in what they need to be doing for that as well.